Hello, welcome, and thank you for being a part of WorkSafe's Preventing and Managing Psychosocial Hazards in the Workplace webinar. My name is Cameron Ling, and I'll be your host for this session. Today, we are exploring the following key topics: how to identify psychological hazards, how to prevent them, and what your responsibility is as an employer. Today, I'm lucky enough to be joined by two WorkSafe experts, Amy Salmon, Principal Psychological Health and Safety Specialist with WorkSafe Victoria. Good morning, Amy.
Good morning, Cameron, and good morning, everyone online.
Great to have you with us, Amy. Also joining Amy is Joe Sarafin, Psychosocial Inspector with WorkSafe Victoria. Great to see you, Joe.
Great to see you too, Cameron, and hi to everyone joining us today.
It's fantastic that both of you can join us for this session this morning. A little bit later on, we will be taking questions from the audience, but please feel free to start entering your questions in at any stage via the Q&A chat box. Please note today, though, we will not be covering the draft OH&S psychological health regulations as they aren't complete yet, but please check our website for updates. If I could start, though, by asking you, Amy, what are psychosocial hazards and what is psychosocial risk in the context of the workplace?
Thanks, Cameron. Great question. Good way to start. So psychosocial hazards are factors in the design or management of work that can increase the risk of work-related stress, which can lead to physical or psychological harm. So some examples of psychosocial hazards are things like poor supervisor support, it may be sexual harassment, bullying, work-related violence, high job demands, or poor organisational justice. So when psychosocial hazards occur and they're present in the workplace, they often co-occur. An example of where that happens is where we might see something like bullying. So what we might see is bullying as the outcome, but often what's underlying that is something like role clarity, where there might be two employees who are a little unclear about their responsibilities. They've been tasked with the same project. And so they may then start to have some conflict with each other as a result of not being really clear on what their roles are. And as a result of that, they may start treating each other poorly, which can lead to an outcome like bullying. So we often see that they're underlying bullying, for example, there are other psychosocial hazards which might also have an impact. So it's really important that when we're thinking about psychosocial hazards, we don't think about them in isolation because, yes, they often co-occur. And when they do co-occur, that increases the risk. So the psychosocial risk is the risk to health and safety that arises as a result of exposure to a psychosocial hazard.
Amy, what is the data telling us about the current situation?
Yeah, so there's some general data that we have in our annual report, WorkSafe's annual report, which talks to the state of mental health in Australia. So what we know is 45% of Australians will experience a mental health condition in their lifetime, and 1 in 5 Australians will experience a mental health condition in any 1 year. So it's really prevalent, mental health as an issue. And more specifically, when we're looking at the data at WorkSafe, what we can tell is that there are 40% of injured workers who have a mental injury that are back at work at 6 months compared to 73% of workers with a physical injury. And also that 80% of injured workers with a physical injury who are unable to return to work within 2 years will develop a secondary mental injury. So this is telling us that there is something about the workplace that is contributing to mental injury in Victoria. And in addition to that, the cost of this is really high. So the average current size for all payment types for mental injury is sitting at $290,000.
Wow, there's some concerning figures there, Amy. Thanks for sharing those with us. Joe, if I could come to you now, can you talk us through the types of risks?
Yeah, so psychosocial hazards, I should say, can create a risk of work-related stress, which can lead to psychological or physical harm. Stress itself isn't an injury, but if workers are stressed often or over a long time or have the level of stress is high, it can cause harm. So psychological harm may include anxiety, things like depression, post-traumatic stress disorder or sleep disorders. And physical harm might include musculoskeletal injuries, chronic disease, or fatigue-related injuries. So there's a greater risk of work-related stress when, as Amy was talking about, where the psychosocial hazards combine and act together, which can create new or higher risks. So it's important to consider all the psychosocial hazards that people might be exposed to at work when managing them. And whilst some of the psychosocial hazards might not create a risk on their own, when they're combined, it can increase the risk. So say when you have workloads are high, it might mean that people can't take breaks and it may result where someone's not around to help them. And some hazards may only create risks when they're on their own, when they're really severe.
Thanks for that, Joe. Amy, just back to you for a second. How do you identify psychosocial hazards? What do they look like?
Yeah, so it's a great question. So there's really two questions to answer here. One is, how do we identify hazards? And separately, what do they look like or perhaps sound like? So let's start maybe with what they look like. We've got a graphic we're going to show on screen that shows us 15 psychosocial hazards that WorkSafe recognises. So as we mentioned earlier, hazards are factors in the design or management of work that can create a risk to psychological health. And the examples we have on screen are some of those hazards that can create the risk. So just looking at this graphic in front of us, we can see high job demands, and that can be physical, emotional, or cognitive high job demands. Physical being things like hours of work, or it could be a workload itself. High emotional demands might be responding to distressing situations or supporting clients in distress. And cognitive high job demands can be things where you might need to have cognitive effort that's required to be sustained for extended periods of concentration. We can also see in the graphic here poor workplace relationships, which refers to negative interactions that can start with things like low intensity incivility or sarcasm, mocking, social exclusion. And then if it's left unaddressed, it can escalate into more damage interactions like bullying or work-related violence or aggression. This could be in writing or it could be verbal. Another example we've got here on our graphic is poor organisational change management, and that often arises when we change processes or things in the workplace without really good communication and consultation with our staff, which can further increase anxiety relating to job security as an example. So the second part of the question is, how do we identify hazards? So there are a number of different hazards that could present in the workplace, but how do we look at identifying them? First of all, the most important thing you can do is ask your people. So it is as simple as a conversation. Asking people what they like about work, don't like about work, and what can be improved is a really good start. Surveys can be used in bigger workplaces where information can be de-identified. There needs to be an awareness, though, that sometimes in these conversations and surveys, we might have people who are not comfortable raising issues, and that itself could be an issue or evidence of something not quite right in the workplace. So we need to look at other data sources when we're trying to identify hazards. Some examples of that could be timesheets and hours of work, which might tell us whether there's a risk of high job demands, absenteeism rates and hotspots, job descriptions, reviewing them to identify if there might be any inherent risks. Is there anything in the job that we do that is a risk that is harder to control? So work-related violence, as an example, might be present in roles with contact with members of the public. We need to look at incidents and complaint data. That will give us some indication of what people are reporting. Compensation claims are a really good resource. They can help us to understand what are some of the factors or things that have contributed to those mental injuries. De-identified EAP data, staff turnover, exit interviews, so underutilised. They're an amazing resource in terms of being able to tell you why are people leaving our organisation, and often underneath that there's some psychosocial hazards. So it's really important that a full review is undertaken to make sure you get a really good picture of what are the risks in our workplace.
Just continuing on from that, Amy, how do these manifest?
Yeah, so initially what we see when employees are exposed to a psychosocial hazard is usually an initial negative response. So it could be something physical, cognitive, emotional, behavioural. So it's really something that you can see in the presentation of the employees in your workplace. It might be withdrawal from conversation. It might be increased irritability. It could be absenteeism, reduced performance. They could be describing physical symptoms like headaches, fatigue. That might be an indication of there being something in the work environment that is contributing to their mental health or the deterioration in their well-being. That's the main thing, is to look at those early signs and then to start having the conversation around what's going on for you. What are the things that might be resulting in this change in your behaviour or presentation?
Great. Thanks, Amy. Joe, could you perhaps outline what duty holders' current responsibilities are in relation to managing psychological health?
Yes, so under Section 21 of the Occupational Health and Safety Act, employers have a responsibility to provide and maintain a working environment that is safe and without risk to health. And under the definitions of the OHS Act, any reference to health includes psychological health as well.
Just flowing on from that, Joe, what does that mean in the workplace?
Yeah, so it means employers have an obligation to identify and control risks of psychological health in their workplace. This involves treating psychosocial hazards like any physical hazard. So identifying them, as Amy was talking about, and identifying which are relevant to your business and conducting a risk assessment to help determine controls.
Joe, I want to stay with you. What is the first step in preventing and managing some of these hazards?
Yeah, so it's really about knowing what they are and what they look like in your workplace, understanding that they can and often do overlap. They very rarely occur in isolation, and applying the risk management framework to identify, assess, and consider controls or change demands.
Amy, if I could come back to you now, what are some of the processes that could be enhanced in the workplace?
Yeah, I think what we often see is when an employee presents with a mental health issue or they present with concerns, employers are really quick to recommend EAP. And I think that's a great resource for individuals. It's good to assist in managing their mental health, but unfortunately EAP is in itself a Band-Aid solution. So it's aimed at addressing symptoms, not the cause. So what we need employers to focus on is about what aspects of work are potentially impacting on that person's mental health. A good example of this includes our workforce of first responders who are required to respond to traumatic events or violence and aggression. Historically, employers have focused on developing their systems of work on reactive measures like EAP for support or debriefing post-incident. And an EAP may also provide some training relating to resilience or stress management. These interventions, however, don't eliminate or reduce exposure to the hazard, and they are reactive in nature. So the best approach really involves undertaking a risk assessment to seek to identify the hazards that employees are exposed to, which may include other hazards, as we mentioned earlier, which can increase the risk. It could be things like poor support, high job demands, or poor organisational justice, and then making sure we're tailoring our preventative controls to address the risks identified, potentially through something like good job design.
Amy, do you have any examples perhaps of effective risk controls in the case of those first responders that you mentioned?
Yeah, I think as I mentioned, historically the focus has been on supporting people and recognizing that it's an inherent risk. So and that's really important. And there are situations where you can't eliminate exposure. However, there are ways to limit exposure to traumatic content as far as reasonably practicable. So if you're attending to an event, does a person actually need to be at that event? Do they need to be at that front line and exposed to that traumatic scene? Do they need to be right there where the violence and aggression is happening in the emergency department, as an example? When we're thinking about content, flagging written, photographic or video material that may be traumatic and limiting exposure only to those who absolutely need it and targeting their viewing to what they actually need to be viewing it for. Supervision is a great resource. So clinical or professional supervision for people who are repeatedly exposed. That can help to be able to process that, and ensuring, very importantly, that other hazards are reasonably controlled, like high workload, managing hours of work to reduce the impact of fatigue, and ensuring there's really good support in the workplace. Because if you're able to control some of those other hazards outside of the exposure, you're really likely to reduce the likelihood of psychological harm. So yeah, really making sure that there's a focus on a holistic risk assessment in those situations and considering the interaction of hazards.
Joe, what about some examples of cases you've worked on where you think incidents could have been prevented?
Yeah, so similar to what Amy was talking about, where the psychosocial risks are an inherent part of the job. So quite often we might see high job demands or workloads. So this could be where an employee has too much to do, too many clients, it's a fast-paced workplace environment, or there's significant time pressure, or that it's beyond the employee's capability or training. So in this example, risk controls should really focus on job design. So control measures for job design could be considering the work environment or the working conditions. They should address things like the time pressure, long or irregular working hours, mentally, physically, or emotionally demanding work. And really coming back to consulting with workers. So do you have adequate staff levels? Do you have realistic and achievable targets? Are there regular reviews of the workloads? Do you monitor the workloads? And really encouraging people to speak up when these are becoming an issue.
And Amy, any examples from you?
Yeah, so there's some certainly some examples of work-related violence which could have been prevented in various settings. So, for example, work-related violence in a retail setting. There are a number of factors that contribute to the occurrence of violence in those settings, including resourcing during busy periods. So if you think about you go into a retail environment, not enough staff there, that automatically leads to a bit of tension, frustration from the people that are also in a very busy environment in the retail setting. Low role clarity, so knowing what responsibilities there are and having good training relating to what is expected of a staff member in their role, and using technology or understanding products, and a lack of deterrence or supports available like security or CCTV to be able to respond when those incidents arise. So it's really important in those situations that there's projection of resourcing. So looking at good data, where are our busy periods, what kind of induction do we provide to our employees? What training do we give them to understand their role? Do they have a good role description? What support do we have in place for staff in relation to product knowledge? Do they understand how to de-escalate in a situation where there might be violence or aggression? And do we have access to on-site security or security readily available? CCTV, duress arrangements could also prevent or mitigate the seriousness of incidents. Similarly, work-related violence in, say, a residential care setting, that's another challenge that we see. And often there's clients, residents or patients entering those facilities with behavioural challenges that need specific and sufficient support to assist them to be able to cope. So it's really important there's good intake assessments for those individuals to be able to determine the risk levels and determine the supports that are required in order to effectively manage that risk, which really comes back to staffing and resourcing. Having good processes and procedures for when risk escalates and making sure that your staff know about those, having really good duress systems that allow quick response and post-incident support. So again, thinking about exposure to a hazard, it can increase the risk of harm if there is exposure to another hazard, like, for example, post-incident support or not insufficient support after an incident. So it's really important that that support component is put in place to really try and mitigate the risk of psychological harm when there has been exposure to an event like that.
Well, Amy, continuing on with you, what do you think is the best way to manage these types of psychosocial hazards?
Feel a bit like a broken record, but using that risk management cycle and undertaking a really detailed risk assessment from a psychosocial perspective. We really need to understand the risks in our workplaces and then tailor our risk controls to those specific risks. So the most important thing to do, and the best way to do this, is to consult with your employees about what they think will assist in controlling the risk and what the risks are, but also what they think will assist in controlling the risks. And focusing on higher order controls, like things like job design, to seek to eliminate exposure to the hazards where we can. We really want to move away from just having policies, procedures and training as our go-to controls, because they don't effectively control the risk on their own. It's important to have strong and supportive leadership who are aware of their responsibilities in this space and are supportive of the interventions that are in place, and having that message of looking after staff as being absolutely key, particularly when they are the key resource in your organisation. All areas of the organisation working together, in particular HR and OH&S. It's really important that we have those two work areas working really closely together in this space, because historically psychosocial matters have moved more into the HR space, but there are obligations from an OH&S perspective. So the sharing of information between those two work areas is absolutely critical. And again, I'm just going to keep reiterating this because I think this is absolutely key, is consultation all the way through, making sure that even in the review and revision of controls, that there is consultation with employees to make sure that you fully understand the risks, and the risk profile might be changing over time. So being aware of any emerging risks as well.
Thank you, Amy. Definitely not a broken record, just very, very important key messages there. Thank you so much. Joe, if I could come to you, as an inspector, what hazards are you seeing the most out in the field at the moment?
Yeah, so particularly high job demands, so high workloads, and bullying are probably the most that we get that come through.
Okay, thank you for that, Joe. And I'm sure that's going to be reflected in the questions that we're getting through right now. I'd love to go to those questions, as there's a number coming through, and hopefully I'll get to as many as possible. I'll start off with one that a lot of people are wanting the answer to. I'll try and direct them as best I can, but please jump in or add anything on that you'd like to. As the OHS Act's intent is to eliminate risks, can you give examples of elimination type controls, or controls that sit above administration type, i.e. policy, training, processes? You mentioned, Amy, those types of controls.
Yeah, would you like me to answer that?
Please go for it.
Yeah. So I think what we're looking at when we're looking at eliminating, we are looking at job design. So or job redesign. So if we have jobs that already exist in a workplace, we're looking at reviewing that position and identifying, are there ways that we can eliminate exposure to this risk? So let's think about low role clarity. And it seems like a simple one, but one of the things that can be done in that space is looking at and sitting down with employees and asking them about what are they actually doing in their job, and looking at the job description and making sure that matches up really well. This is a really great activity to do with your staff to help them to be able to articulate what they're doing and help you to be able to understand what are the potential risks. And it opens up more opportunities for conversation about other risks that might be arising, like high job demands or poor support. So we might then understand that there are some challenges here relating to the training that's being provided to these employees in this role. So I think job design is absolutely a really good control measure, where you're looking at reviewing positions and consulting with employees to try and understand what are the hazards and how can we potentially avoid exposure to that. I'll give one more example. It might be that there are ways that we're doing things at work that are increasing the risk of work-related violence. So an example of that might be that because of the way that we are responding to phone calls, for example, or the way that we are guided or directed to do our work, it might result in the people that we're on the phone to becoming agitated. So in listening to calls or learning from our experiences, we might start to hear that when we're having this conversation, the way that we're having it is actually leading to more aggression or violence. Whereas we can also see in another setting that when we have the conversation in a different way, it reduces the likelihood of that aggression or violence occurring. So we're starting to move towards an elimination if we're continually improving our processes and redesigning the way that we do work in order to reduce exposure to the hazards.
Great. Thank you for that, Amy. Makes a lot of sense. This next one, a number of people are wanting the answer to, and happy for either of you to jump in. How do we manage these risks as middle management, i.e. there is only so much within our control and issues may be more deeply embedded across the organisation?
I'm happy to jump in on this one. Yeah, so it really comes down to that consultation piece and having your leadership buy-in. So getting everyone across the organisation to have buy-in. If you've consulted with your workers effectively, you can raising what the current risks are, and even pointing back to that data that Amy was talking about earlier. These things have a big cost when someone does get an injury. So really using that information to get buy-in from your leadership, and making it clear that these are an obligation to make sure that they're providing that safe working environment. To help sort of push your message, I guess.
Great. Thanks, Joe.
Can I add to that? Is that okay if I add to that?
Absolutely.
Yeah,
Absolutely.
I think reporting is so important, incident reporting. I think it is absolutely critical in order for the right people to be getting the right message around what are the risks. So I think we know that psychosocial incidents or hazards are not often reported in the same way that physical incidents or hazards are. So I think it's really important that that reporting process starts so that there's a really good picture for people at the right level to understand what are the risks in our work environment. And I think that can help to shift the dial from just the conversation continually coming from middle management and escalating. It's really also look at this data, look at what we can see here that's showing us that there's really a problem.
Great. Thanks, Amy. I might stick with you, Amy, on this next one. A really important balancing act, this question. Sometimes employees say the job demands are too high, but others with the same role do not feel the same. If we lower one person's demands, it affects the whole team and work outputs. How do you deal with situations like this?
This is a great question, and it's one that comes up, I think, every single time I speak. And I think it's very fair. There's a lot of ways to answer this question, but what we're looking at when we're looking at what is an effective way to control a risk of potentially high job demands is there being a really good workload management and monitoring system in place. So, and I think there's a pre-question, there's a part to this too. So how do we recruit people for our roles? How do we make sure that we've got the right people in the right roles with the right capability? Also, if we understand that there are people or we see that there are people who have been performing in the past, and then they suddenly start to not perform in the way that they have previously, what might be going on for them? And can we have a conversation with them about whether there is something in the work environment that has changed that might be contributing to an impact on their performance, as I mentioned earlier, with some of those kind of early signs of where there might be someone struggling. Then if we know that we've got pretty good people in the role, that we've built enough capability, that we've given them the support and resources they need to do their job, then having that workload monitoring system in place is so important because it helps us to be able to understand why are some of these things happening. And what that might look like is regular check-ins with staff to ask them about how is their workload going, looking at their workload, looking at the complexity of cases, because sometimes the data can be deceiving. So it might be someone who's sitting there with 4 cases compared to someone who's sitting there with 10 cases. It might look like there's an imbalance there, but the complexity of the work in those 4 cases might be a lot higher. So what we want to see is a system that allows for that to be managed and for the work to be allocated fairly and evenly to reduce the risk. One of the other things I would say about this question is that I like people to think about what it's like on a day-to-day basis for them in terms of their ability to cope with a high workload. So on some days you might wake up in the morning and you might have woken up early. You might have been woken up early by kids or by a garbage truck out the front, and that might start off your day in a not a great way. You might then come downstairs, stub your toe, and then you get out the door, you get stuck in traffic and you get to work. Your ability on that day to cope with a high workload is much lower than when you have started the day with a good sleep in, no garbage truck, no kids, and your toes all right. So I think it's really, we've got to think about things on a spectrum and take into consideration that people's ability to cope with demands can change on a day-to-day basis.
Great, thank you for that.
Add something, if that's all right, Cameron.
Absolutely, Joe.
I think the question also kind of comes down to that part where when you're doing the redesign, you've also got to be careful that you're not just shifting the risk as well. So you're trying to reduce the exposure to all of these psychosocial hazards, but you don't want to reduce someone else's workload, but create a risk for another person because you're just shifting it over.
Great point. I might stick with you, Joe, on this one, I think, but please jump in, Amy. How are WorkSafe Victoria preventing and managing psychosocial hazards in their own workplace?
Yeah, that's a good question. So we have, we have lots of support available. So in my role, for example, there's an increased, because I'm a public-facing employee, deal with fairly serious cases sometimes. Sometimes there's that exposure to traumatic content or events that's involved. So we actually have a proactive sort of wellbeing check program where we speak with a psychologist every few months. And we also have regular check-ins, with my team leader. There's lots of resources and supports available, peer support networks at WorkSafe, lots of proactive sort of wellbeing programs as well. But yeah, it's all about that sort of monitoring in that space, particularly. I don't know if you had anything you wanted to add, Amy.
Yeah, I think like all workplaces, we are on a journey and we are continually identifying our risks. So I think Joe's pointed to one, which is a pretty obvious risk in terms of our interaction with the public. But for every team at WorkSafe, there are different risks. So that's why it's so important that for each team, there's a risk assessment undertaken to be able to identify what are the specific risks in our team. So if you think we've got call center people, we've got people in our insurance arm, we've got front-facing people going out onto work sites, we've got remote and isolated work. We've got that exposure to trauma. There are high workloads potentially. So each team has its own little risk profile. So really that's where the focus is looking at what are the risks in each team and then tailoring the right controls to those teams in consultation with those teams.
And these risk assessments aren't a moment in time. They're ongoing, continuous processes that you're constantly reviewing and adjusting the controls to see what works.
Great, thank you. Lots of questions coming through on this one. Does mental health first aid training help to control psychological risk in the workplace?
Who would you like to answer?
I don't mind.
Who's best to answer that one?
I mean, but we probably both will. Look, I think mental health first aid, it plays a role in building capability and understanding in workplaces relating to mental health. So that's great. That's a really good foundational piece. And we think about reducing harm holistically. So there obviously is a role in having good understanding of mental health, and mental health first aid can play a role. However, unfortunately, it seems to be one of those things that employers do rely on as a control, and it isn't controlling a risk in relation to exposure to a hazard. I mean, potentially support, it's probably increasing support, but that is a very small component. And again, it's kind of that solution that is a Band-Aid solution where it's looking at how do we help people who have already been injured, whereas we want people to be focusing on and employers to be focusing on prevention. So looking at can we eliminate exposure to these hazards like work-related violence or remote and isolated work or poor organisational justice by having good policies and procedures and that sort of thing in place. So we really want the focus to be shifting away from that just the support component or the post-incident reactive measures and really focusing on how can we prevent exposure, how can we mitigate harm, how can we reduce the likelihood of there being co-occurring hazards like high job demands when you're exposed to work-related violence, which might increase or decrease your ability to be able to then access supports because you're so busy or take breaks that you need to be able to process what you've been exposed to.
Yeah, great. Thank you, Amy. Next one here, and I'm happy for either to jump in. With regards to anxiety, is this considered a psychosocial hazard / risk when it is as a result of reasonable management action?
Do you want to answer, Joel? Or would you?
Yeah, sure. So I guess it is a psychosocial risk. It's creating a psychological injury, essentially. I guess with reasonable management action, so what we're referring to here is performance management. Quite often I'll see cases where we have reports of bullying in the workplace, and it might just be a case of not necessarily, so bullying we define as repeated unreasonable behavior, negative behavior that creates a risk to health and safety. So when employees are performance managed, sometimes they'll experience that or believe it to be bullying, but it might actually just be reasonable management action by the manager. It's just been perceived as bullying in that sense.
I would add something to that. Sorry. Yeah. Just in relation to the way that that's done, right? So it could be reasonable management action in the process of actually undertaking performance management. But it's how are you doing that? Are you doing that in a fair and reasonable way? Do you have good policies and procedures in place relating to how this will happen? Do people have an understanding of what the expectations of them are? Are they given reasonable opportunity to actually improve and being given feedback about that? So those are the things that would be taken into consideration when you're looking at whether something is reasonable or not, because it's not just the performance management component. It's also how is that done? Is that done in the right way? Because it can create a risk of poor organisational justice if performance management is not done in a fair and reasonable way, or there's unclear expectations set. Sorry, Joe, I think I cut you off.
No, I was sort of going to come on to that, but that's absolutely fine. So definitely it can lead to that organizational justice hazard. It can also lead to quite often poor workplace relationships as well. You know, you've got a dispute between a manager and an employee. Look, I think there's no easy way to say it, but it can create that anxiety and the risk from that. But I think the key is sort of identifying it, monitoring those sorts of things, and comes back to, you know, reporting it and raising these issues with your employer, so that they can be addressed.
Joe, I might continue with you on this one. Can you give examples of how staff can report bullying/harassment without having to make a formal report to their manager or HR to ensure the organisation is meeting the positive duty? Staff often want a behaviour to stop and fear being labelled as problematic if they formally report an issue.
Yeah, there's sort of a few different things going on in that question. I guess, so we would always come down to how is an employer meant to address an issue if they're not aware of it? So the reporting is really key. Quite often people are fearful of reporting things because of the repercussions for reporting something. And it is complicated. It's not simple. But we would always encourage anyone to report these sorts of behaviors to their employer. Sometimes you might have sort of whistleblower lines or ways of reporting things anonymously. In the first instance, it's always like one of the first steps prior to even that reporting, though, is actually addressing the behavior itself. You know, if they're coming from a particular person, speaking to that person directly, or speaking to a health and safety rep who might be able to assist you or represent you. But yeah, once it's basically, there should be avenues to report it and get support within your workplace. And once it's reported, the employer would then need to, they have to address it, right? When it's anonymous, it can make it really difficult for an employer. When you've got an anonymous report from someone about someone else, it can be very difficult to verify, speak to witnesses and actually properly investigate when you've got this anonymity around it.
Great. I think that's a really fair challenge, I think, Joe. I think there is opportunity though where there is repeated bullying behaviour, but and there's anonymous complaints, and we can step back from the individual situation where I think the fear is I don't want to go down a formal complaint pathway, and that is fair. That is totally reasonable because that in itself can be a really difficult process to go through. I think this is where OH&S steps in, right? This is where we look at from a hazard perspective, when we're thinking about this is a hazard, this is an OH&S risk. Can we look at it through that lens? Can we review and revise our system of work for the prevention and management of bullying? Can we look at, are our managers trained in relation to how to step in? Are our people comfortable with how to intervene or have these types of conversations if they need to raise an issue with someone? Do we have good supports in place? Are there other hazards that could be driving this kind of thing? Is there a high workload potentially for that person who is being perceived as a bully that is therefore causing them to be more irritable or to have their interactions be a bit more firm, which is then leading to people perceiving that they're being bullying. So if we just looked at the bullying as it's on its own, and then we address that through individual processes like HR processes or investigations, we're not really going to get to the heart of the problem and reach a resolution in terms of resolving the behaviour, which might be, it may be bullying behaviour, but it's coming from someone with high job demands, and the high job demands are likely to continue. So even if their behaviour changes for a short time because they've been reprimanded as a result of a formal complaint, we still need to look at what is that driving psychosocial hazard that is contributing to their behaviour, or they are likely to return to that behaviour again in future as a result of the impact of the other hazard.
Really important. Thanks for that, Amy. Lots of questions. I'm conscious of time, so I'll ask this one last one just really quickly because it's a really good one, maybe just to help people on their first steps. When making a plan to manage psychosocial hazards, what is a good place for an employer to start? E.g., first actions that can start the process. Amy?
Yeah, so I think it's really the consultation piece and communication. I think if you tell your employees that you're planning to tackle this problem, you're already on the start of the journey, and you're going to help employees feel like they've got an opportunity to be heard about something that is a really challenging thing, and it's likely to be impacting them in one way or another. Whether it's causing psychological harm, we don't know, but starting that conversation by letting them know this is what we're going to do. Then thinking about and strategizing and gathering our data around what do we already know, what do we already have in place, and then starting a plan from there. I'm sure Joe's got something to contribute to this too.
Look, it's just coming back to that same thing again about consulting with your workers and going through that risk assessment process, like identifying which one of these hazards or which of these hazards are relevant to our business. Look, there's going to be every workplace out there. There's going to be some. So it's trying to work out which are the most important. You can only do that through speaking with your employees, and speaking about it with your employees helps drive that conversation that, we are going to tackle this, and this is how we, develop ways to address them.
Great. Thank you so much. And thank you to everyone who's asked so many questions. Obviously, a really important topic and so many people keen for information. I apologize for all of those questions I didn't have time to get to. I'm really sorry for that because we are coming to the end of our allotted time for this webinar, but perhaps I'd just like to ask both of you, what would you like your audience take out to be? You might have touched on these a little bit already, but any actions you would like to see them change or implement? Maybe starting with you, Amy.
Yeah, I think, and I will be a broken record, but it's consulting with employees throughout the whole risk cycle. So making sure that you're using the risk cycle, identify and assess your risks, implement controls, monitor and review, making sure you're going through that monitoring and review. It's not a set and forget. That consultation piece, absolutely. That's the key. That's the biggest takeaway. Talk to your people because they know what to do. They know what the problems are and they know what to do about them. And really importantly, encouraging our occupational health and safety or work health and safety people and our HR people to be working together, sharing information. It's going to make both of your jobs so much easier if you're working together. The responsibilities and the control for this sits across both areas. So if they can't work together, our risks can't be effectively controlled.
Great. And you, Joe?
Yeah, so for me, it's really trying to focus on far too often we see employers focusing on lower level controls, such as the training or the policies. But it's really important to focus on those higher order controls and the actual system itself. So things that will have if you can actually redesign the work and reduce these risks, it'll have a bigger impact. And also that there's lots of resources available out there. So the Work Well Toolkit would be one of them. And consultation with your workers is really key.
Great. Thank you so much. Thank you to both of you for your time today. Amy Salmon from WorkSafe Victoria. Thanks so much, Amy.
Thanks, Cameron. And thanks everyone for joining us.
And big thanks to Joe Sarafin, also from WorkSafe Victoria. Thank you so much, Joe.
Thanks, Cameron. Thanks, everyone.
Great to have you both part of this, sharing your insights and examples today, explaining that psychosocial hazards are an OHS issue that can be addressed in a range of ways. Much like a more obvious physical hazard, they need to be taken very seriously by employers in every sector. We hope that everybody has found this an interesting and informative session. This webinar will be made available on WorkSafe's website in the coming weeks, so keep an eye out for that. We very much value your opinion on our Health and Safety Month events. So shortly, we will be sending you out an online survey. We would love it if you could provide some feedback so that we can incorporate your suggestion in our program next year. All respondents will go into the draw to win one of 5 $100 gift cards. Shortly, we are going to show on screen a list of all the contacts or programs that we have covered today. And if you have any requests for further information, we recommend you to please get in touch. There's the WorkSafe advisory line, which is open Monday to Friday, and then the emergency line, which is open 24 hours a day, 7 days a week. So please utilize either of those. Thank you so much for being part of today's webinar.